I'd like to call to order the HHS meeting of August 3rd, 2021. Roll call, please.
Okay, Chair Renahan.
Here.
Vice Chair Swarzy. Member Selman.
Here.
Member Jacqueline. Member Dessart.
Here.
Member LaPlante.
Here. As always, Member Garcia has joined us. And I understand we do not have public comment.
No public comment.
So just as we know, today we're going to be starting our budget presentation, starting with community services and Mary Keating. I encourage you all to ask your questions, ask for any clarification, anything you need as we go along. And I'd like to begin with having Mary Keating speak a little bit to rental assistance and eviction. I know it's all in our minds. This moratorium has come to a close. Go ahead, Mary, please.
Sure, I've gotten a couple questions from board members, so I just kind of want to give you an update on what's happening in that world. Thank you. The IDA program, they are currently, the portal is closed, but they are working through all of the applications that have come in. As of the middle of last week, about $7.7 million in rental assistance has gone out to DuPage County landlords. We have a meeting with IDA staff tomorrow to talk about sort of their next steps. They do intend to spend basically the month of August reaching out to anyone who completed an application and needs to provide additional information. So that's their August focus. I think they intend to open the portal back up again, probably in September, but they go through, they take the applications, and then they stop, and then they have approximately 300 people who are working on this. So it's an enormous task. But the meeting tomorrow is to kind of talk about next steps and any kind of enhancements we might need in the program. In the meantime, Joan Fox from our staff has been working very closely with the eviction court, with Kimberly Verist, who is the coordinator. I'm not sure what her title is. Kimberly's great. She used to work at the Family Center, and the court system took her away from us, but she's awesome. And Joan has been working with her closely, as well as with Prairie State, to talk about how we can sort of insert ourselves into the eviction process. I think, in a perfect world, we'd have somebody sitting there with a checkbook, but things are extremely complicated just in terms of working through the court system, how we get inserted early enough in the process that we can maybe avoid at least a second court call. Maybe we can get inserted. I've requested a meeting with Candace Adams from the Circuit Clerk's office and any appropriate staff from that office, so that we can really figure out from a process perspective. Judge McCloskey is extremely supportive of all of this work. I have to say he very much is interested in giving tenants access to whatever resources we have. For quite some time now, he's been handing out information about our information and referral division, rental assistance available through various channels. So he's very open to figuring out how we can get ourselves sort of inserted into the process. Ideally, we'd be able to come in with financial assistance even before the mediation process. So Judge McCloskey's vision, I think, is that each eviction will go to mediation. If it's for financial back rent only, we'd love to get involved in that process before it goes to mediation, so we can just kind of reduce that workload for mediation. So a lot of progress being made, but a lot of systems to work through, not the least of which is the court information system. Joan was telling me yesterday that because all eviction records are currently sealed, we can't actually find any of the information. So so that's why we need to talk to the clerk's office and see what kind of outreach and insertion we can do.
What does mediation look like? I mean, normally in mediation, both sides pay something, and if somebody can't afford their rent, they're not going to be able to afford mediation. So is it free to the renters or not?
I believe it would be. They would be ordered to mediation, and the idea of mediation in the eviction court is to try and find some sort of resolution. Typically, a date that the tenant agrees to move out. Maybe maybe giving them a little extra time, so that we could also come in and perhaps help rehouse them with security deposits, those kinds of things. So,
It's
Okay,
great.
Mary,
Yeah,
I had a question. I was contacted this weekend by somebody who they're in line
mhm.
from IDA. They know that they're in status, but there's no status. They have no idea whether they'll be
Right.
approved for that. We know August 1st, landlords could file, but as of today, yesterday is the first day they could file for eviction, and with no eviction actually happened until end of August.
Right.
So what do we tell these people? You
Well-
might get the money, you might not get the money, get ready to move.
Well, that will be the part of our discussion tomorrow with IDA, is how do we make sure that people have access to the information that they can. We'll find out from IDA, how are they reaching out to people? What's their time frame for that? I think in the meantime, I don't think evictions will be ordered at the end of August. There is a court process that people have to go through. There's typically more than one court call. So they do have time once they appear before the judge. Once they're in that system, like I said, we're working as hard as we can to figure out how we can make sure that we get inserted so that if it is only an issue of back rent, we can come in and provide that assistance.
Yes, Member Solomon.
As part of your meeting with Clerk Adams, I think we all are interested in reporting sort of as this progresses, like how many cases we have, how many are going to mediation, how much we think we can help with all. And I think especially getting to your point of how many are actually eligible for this, that it's just you're being evicted because you haven't paid and not a bunch of
Other
reasons.
lease
'Cause those-
violations, right?
That's a whole other bucket
Right.
of things, but if
Exactly.
it's just finances, I think,
Mhm.
you know, it sounds like reporting maybe wouldn't be available till maybe even early September, and that's okay, but I think that would be helpful for all of us.
Right. Yeah, and I don't know enough about the court system. I don't know if you know, Joan, when the filing is done, is there an indication of what the violation is? Is it strictly back rent owed, or is it other lease violations? Do you know if
I
that?
don't believe that there's anything in there that says
Oh, okay.
the reasons, like in a statistical way.
See, like that comes out maybe during like that the first mediation,
Yeah,
Okay.
and it's in the paperwork necessarily, but I don't think it's anything we
like
can.
in a field example on our part. Okay.
So I'll continue to keep you updated. Yeah, it is extremely frustrating for folks. I will find out from IDA tomorrow if, what is the process by which people can find out their status. Like I said, the last time I spoke to folks from IDA, which was early last week or either late the week before, they did talk about they wanted to get all of the initial reviews done by last Friday, the last day of July, so that they could focus all of the month of August on reaching out to tenants and landlords who were missing information. They said that the most common missing documentation from the tenant side was documentation of their income, and on the landlord side, it was documentation of past rent due. So unfortunately, Treasury has given us guidelines of specifically what has to be provided, and we don't have any flexibility.
And just one quick thing, when it reopens, the portal opens in September, are we talking another 20 something million to DuPage?
Well, that's part of our discussion tomorrow is, so, the 26 million that we provided to IDA, that was our first tranche of rent assistance money. As I said, I think about 7.5 million has gone out already. So they're working on spending. So what we need to talk about is, what is our plan for our second tranche, which has a much longer spending horizon? So I think we really want to, Joan and I have talked about, if we continue to partner with IDA, I think my vision, my preference would be that we hold some of those funds back for a direct eviction court process. So we're not directing those folks to IDA, but we're really narrowing what we're doing with that funding. So the folks who are sort of, quote unquote, just behind on rent would perhaps continue to go through that IDA program. But if your case has gotten to the point where you are facing eviction, we want to be able to have a direct pipeline to those individuals, not send them to another agency.
Member Solomon?
And then just quickly, it's my own unfamiliarity with how eviction works. Is there any prioritization? So like if it's a family with children, do they like get moved up in the queue for assistance versus if it was like a single child? I'm just thinking about the timing of school starting, how awful that is.
That I don't know the answer to that question. In terms of assistance, the way the IDA program worked was they were first working through all of the applications for households below 50% of median income.
Okay.
And then after the 50% were completed, they were going to the 50 to 80.
Okay.
We don't currently have any kind of mechanism to do that kind of prioritization. That perhaps would be something that we could build in, but I think, as I said, Judge McCloskey is very amenable to whatever he can do. Obviously, he needs to remain an impartial judge, but he's also very cognizant of the needs of the individuals who are being evicted, and he's willing to work with us, which has been great.
Thank you, Mary, for that.
Okay.
Thank you, Joan Fox, for being there on top of everything with the courts. We appreciate it.
Thanks for the opportunity.
And with that, I would take a motion to approve the minutes of Tuesday, July 6th, 2021.
So moved.
Second. Questions, additions, comments? All in favor, say aye.
Aye.
Any opposed? That is approved. Moving to requests that require Financial County Board approval. I'll take a motion to approve FIR 35721, acceptance and appropriation of Illinois Human Services Emergency Solutions Grant, $396,223.
Second.
Questions, comments? All in favor, say aye.
Aye.
Any opposed? That's approved. Take a motion on FIR 35821, acceptance appropriation Illinois Home Weatherization Assistance Program, $661,653. So moved. Thank you. Questions, comments? All in favor, say aye.
Aye.
Any opposed? Motion carries. Take a motion on FIR 35921, resolution for Illinois Home Weatherization Assistance Program, $882,548. So moved. Thank you. Questions, comments? All in favor, say aye.
Aye.
All right. Any opposed? That passes. I'll take a motion on FIR 36021, acceptance of extension of Community Development Block Grant Disaster Recovery Grant extension through September 30th, 2023. So moved. Second. All right, questions, comments? All in favor, say aye. Aye. Any opposed? That passes. Take a motion on FIR 36121, a resolution for low-income home energy assistance program grant FY21, $2,216,090 for community services.
So moved. Second.
Questions, comments? All in favor, say aye.
Aye.
Any opposed? That passes. Take a motion on HHSR 36221 resolution, approval of issuance of payments for DuPage Energy for energy assistance providers, LIHEAP. The HHS grant for FY20, $1,176,882 for community services. So moved. Second. Questions, comments? All in favor, say aye.
Aye.
Any opposed? That passes. Community Development Commission. The next thing will be contingent upon approval at Home Advisory Group. I'll take a motion on HHSR 36321, recommendation for approval of transfer of ownership and assumption of home investment partnership program agreement with Myers Common Senior Housing LLP and Myers Common Harmony Housing LLC, project number HM4-05.
So moved.
Questions or comments?
If I could, I want to compliment Dave on the amount of work that he did to get this project through. This is a senior housing development that we have home funds in, that's in Burr Ridge. And the seller approached us in May, wanting to close in June, which just really wasn't a possibility. It was a new developer who's coming into the area. We've kind of done our due diligence on them. We're very excited about Harmony Housing coming into DuPage County. They're a nationally known affordable housing developer. Their specialty is purchasing existing affordable housing and extending the life of that affordability period. So this project will remain affordable for at least 20 years, or is it 40 for IDA, under the terms of their agreement with IDA. So again, Dave did a great job going back and forth. There was a lot of work, a lot of paperwork that had to be done. At the end of the day, the project, they're increasing it. Instead of 80 of the units being affordable, all 100 units are affordable. And they are assuming the mortgage and note that we had originally on the property. So we've made no concessions. the number of units, affordable units has increased, and the length of the affordability term has increased. So it's a real win for the county.
Great. Any additional comment? Yeah, thank you, Dave. Good to see more affordable housing in District 3. I love it. All in favor, say aye.
Aye.
Any opposed? All right, that carries. Moving on to the care center, I'll take a motion on HHSP 32621 with Lakeshore Dairy for fluid dairies for the care center, cafeteria, and cafes on campus and the judicial facility also. September 1st, 2021 through August 31st, 2022, not to exceed $80,000.
So moved. Second.
Any questions or comments? All in favor, say aye.
Aye.
Any opposed? That is approved. I'll take a motion on change order HHSP 105A-21 Med Search Staffing Services DBA United Pharmacy for supplemental staffing for the pharmacy department May 14, 2021 through May 13, 2022 to increase encumbrance 75,000 amended contract not to exceed 125,000.
So moved.
Second?
Second.
Second, thank you. Questions or comments? Do we have someone on the line from the care center? Anita, possibly?
Janelle is here as well.
Oh, hey, Janelle, can you just give a little bit of background here? We've had a lot of conversation on these types
Sure.
of comments.
So our head pharmacist went out on an FMLA, and we had to replace him on an interim basis. After some months, we got his retirement. So now we are going to be in a position to recruit and hire, but we're projecting that will take some time. So this is to cover that interim amount until we get a new person placed.
Great, thank you so much for that explanation. All in favor, say aye.
Aye.
Any opposed? All right, that is approved. We have a budget transfer. I'll take a motion on expended account 54000, leaving an unobligated balance required to move to project DR18 Elmhurst Quarry in order to fully expend the grant award of $566,462 for community services.
Second.
Thank you. Questions or comments? All right, all in favor, say aye.
Aye.
Any opposed? That is approved. We have a couple of travel requests. I'll take a motion to approve overnight travel for weatherization assessor to attend multifamily QCI training at Indoor Climate Research in Champaign, August 23rd, 2021 through August 26th, 2021. $792.50 for community services, grant funded. Second. Thank you. Questions, comments? All in favor, say aye.
Aye.
Any opposed? That's approved, and we have an almost identical request. Also, I'll take a motion on weatherization program coordinator for the same training in Champaign, Illinois, August 23rd, 2021 through August 26th, 2021, $792.50.
Second.
Thank you, Lynn. Questions, comments? All in favor, say aye.
Aye.
Any opposed? That is approved. I'm informed we can take the consent items all in one grouping. With that, I will ask for a motion to approve consent items A through Q, which basically are contract expirations, decreases, and closings. So the motion?
Second.
Second, thank you very much. Questions or comments? All right, all in favor, say aye.
Aye.
Any opposed? Those are approved. I understand we do not have any residency waivers today.
Correct.
And with that, Janelle, can we have an update from the care center?
Certainly. Good morning, everyone. The Care Center is in the middle of their annual survey from the Illinois Department of Public Health. So the team is very preoccupied handling that week-long process. The surveys, this is our first survey since prior to COVID. The surveys, while many of the processes are still the same, there's a much more punitive focus. So if they're where you might have a minor item that would have been a very low scope tag is now considered a more significant tag especially from an infection control perspective. So the team's doing great so far, and survey team is reasonably pleasant, so we ask for your prayers because it's a daunting process for the staff. The other thing I wanted to mention is our statistics for, well, first let me say we don't have any cases of COVID or variant COVID, so we're very happy there. We are seeing some facilities with those types of cases. I just spoke with the regional IDPH office lead, and he explained that there is a facility in his region that has a positive COVID of vaccinated residents. So certainly something that we're going to continue to watch. We do have our testing parameters, and we're doing that. I know you'll want to know our numbers for our residents and our staff. Our residents are running around 93% vaccinated. We are still working with the health department when we have residents come in that are unvaccinated, and we bring them over on our bus and get them vaccinated. We're very appreciative of Adam and the health department. Our staff is up to about 85% vaccinated. I know that there's a lot of information going around about mandated vaccines, and I know our non-for-profit state and national association has been involved with a lot of discussions. I would not be surprised if IDPH does not come and mandate vaccines for all healthcare workers here in the near future. So certainly something we're keeping a close eye on. We continue to promote it. We just did a sweep, and I think our largest challenge is getting the cards from staff that go and get vaccinated. So that's been a big part of our uptick in our numbers. So certainly something we continue to focus on. That is my update for today.
All right, thank you so much, Janelle. Member Solomon.
Hi, Janelle. I was just wondering, I know one of the last times you spoke with us, you were talking about how the visiting was still being able to open up. Has the visiting had to restrict anymore with the patients with the new Delta variant, or is our having no cases meant that things are carrying on?
You know, it's very strange. The regulations still are changing about every week on that process. And so while they've increased expectations for some areas, the visitation is not one. We always are going to err on the side of caution, but at the same point, we want to continue the visits as much as possible. So right now, there are still visits occurring. It's very strict parameters. It requires a volume of staff just to manage, because we escort people up, we escort people down, because we don't want people wandering the building, which they generally try to do. And that, of course, can create crossovers. So right now we're doing indoor visits and we're doing outdoor visits for unvaccinated, or very strict visits for unvaccinated in a room that has all these different parameters. One of our conference rooms that's set up for it. So we're not seeing, we are seeing some changes, but I would expect more to come. And obviously if we have one case of it could be a student, it could be a doctor, it could be a staff member. It doesn't matter. One case is an outbreak and we would have to shut everything down and do our whole round of testing. We are testing unvaccinated per regulation on a monthly basis, and anyone else that's symptomatic are getting tested right away.
Great. Any other questions for Janelle? Janelle, thanks for all you do.
Janelle, did you say you're testing those unvaccinated on a monthly basis?
That's correct. And if they're symptomatic, yep.
Not weekly?
Janelle,
No,
not
if our community rate, it all depends on the health department and the community rate. So right now we're at 3.7. It changes if our community rate goes above 5%, but the health department's kind of always had us at about 4%. So if we see an uptick, that will change, and that probably will happen here in the next probably week, unfortunately.
Okay, thank you.
Best of luck, Janelle, over there.
Thank you.
Thank you very much.
Thank you.
Moving on to our community services update, Mary Keating, with her 2022 budget report.
If you don't mind, I'm gonna drag the chair over here. Pick the wrong day to wear a sweater. We don't know how hot the masks make you.
And we don't have to play to the camera anymore, right?
Right. So the total annual budget for the Department of Community Services is approximately $25.8 million, not including the special allocations of COVID-related funding we have received. The annual budget includes 2 general fund budgets, 1 special revenue budget, and approximately 16 active grants. I'll be happy to give you all copies of my notes so that you don't have to write everything down. In 2021, the general fund portion of the department's budget was 2.3 million, or 8.9% of the department's total budget. For 2022, the general fund request is 2.7 million, or 10.5% of the department's total 2022 budget. All budget lines for the general fund budget are generally status quo from 2021, with 2 exceptions. Both are in the budget labeled Human Services, and if you flip to that page, you'll see that there are 2 items that are circled in orange. The first is under the matching funds contribution line. I'm requesting an increase from 200,000 to 450,000. This budget item is specifically allocated to provide county support to the senior services budget. The total senior services grant budget is 4.48 million, and the county's subsidy level of $200,000 represents 4.5% of that total. Just to give you some historical perspective, the county's $200,000 subsidy is the same as it was in 2001, when the seniors budget was just under 1.5 million, and the county support represented 14% of the total. As the seniors division has grown, the county support has not increased proportionately. For newer board members, this pressure on the seniors budget and need for increased support from the general fund is something that I have been bringing to the board's attention for several years. In 2019, after the psychological services division was moved to the health department, creating an annual savings of the county general fund of over $900,000, I requested that 400,000 of that savings be moved to the seniors match. However, that increase was provided only in 2019. The general fund match was cut to 250,000 in 2020 and further cut to 200,000 in 2022. The 2022 requested increase would do 2 things. First, it would restore the previous 2020 level of county support to the seniors division to 250,000. It would provide an additional $200,000 funding for salary increases in the case manager positions. As has been discussed at the Finance Committee, we're experiencing significant difficulty recruiting qualified staff for our case manager positions, as well as many other positions within the department. In fact, we currently have 7 open case manager positions in the senior services division alone. In order to address this challenge, we're examining all positions throughout the department. For the most part, salary increases in the department can typically be addressed within the grant budgets that make up the largest portion of our budget. However, the seniors division is the exception. There is not adequate budget in the seniors grant to absorb the additional salary increases. Therefore, in order to create equity across the department as we look at overall salaries, we would need additional general fund dollars to support any increases in the seniors division. The second increase in the 2022 budget request is for the Paratransit program. The county provides transportation through DuPage for 2 purposes. First, we provide transportation to medical services for low-income persons not eligible for Medicaid transportation. Second, we provide transportation to work for persons with developmental disabilities through 5 partner agencies. The services are provided by PACE through contracts with various transportation providers. In late 2019, PACE rebid the contracts and experienced significant rate increases that impacted our costs. However, due to the significant drop in ridership during the pandemic, we did not see an increase in those costs. As we anticipate returning to 2019 ridership levels during the 2022 year, those cost increases will be reflected in our monthly invoices from PACE. Therefore, I'm requesting an additional $200,000 to cover those increases. Without this increased county support, our options would be to raise fares for those services, restrict rider eligibility, or a combination of the 2. That is my general summation of my general fund budget. The third budget that you'll see there is the neutral exchange fund, which is a special revenue fund. Again, it's a status quo budget. You'll note outside agency support, the Human Services Grant Fund is again not included in this budget. However, when I give my ARPA presentation next week to the Finance Committee, you'll see a reflection of nonprofit support through that program. So with that, I'd be happy to answer any questions.
So your entire community service budget is 25.8 million, in which 2.7 3 right now
Mhm.
comes from the county. The rest is all grants?
All grants.
Okay. With regards to the transportation, have you had any feedback from residents on the quality that the job that PACE has been doing?
Yeah, there's been some significant issues with the quality of the transportation, particularly in the last year. So we are one of many sponsors under the Ride DuPage program. Other sponsors include Milton Township, Glen Ellen, Wheaton, Lyle Township, Naperville. The sponsor representatives get together on a monthly basis and meet with PACE representatives. They are sort of escalating those issues that have arisen recently. I am not by any means meaning to excuse PACE's and their contractors' lack of performance. The delivery of paratransit service is a very difficult and very complicated job. My thought is that, like most service industries, contractors are probably experiencing a labor shortage. Again, it's not certainly doesn't excuse the lack of quality of the service. There's also been some real communication snafus with PACE, making some changes to the anticipated pickup and drop-off windows. They did that during the pandemic in order to accommodate, because during the pandemic, when those services were operating, they could only transport one passenger at a time. So it made it much less efficient. And so the difficulty of scheduling in small pickup windows, it just couldn't be accomplished while maintaining that distancing of passengers. So that's what I know. I know that the sponsor group is reaching out to PACE leadership to see what can be done to improve the quality of service.
Are there any other, and this might be, my next meeting is public transportation, but in your knowledge, is there anybody else out there that could provide these services?
Well, the issue with trying to go out to a private contractor would be the cost of vehicles. PACE currently provides those accessible buses to the transportation providers. If you take them out of the equation, the transportation providers would have to make the capital investment to have those accessible vehicles. And so I think that's probably the biggest issue. PACE does also provide subsidy to a number of the kind of municipal dial-a rides. So I would assume that PACE would not subsidize something that was being contracted with a private entity. So
Thank you. Thank you.
Member Solomon?
Also on the paratransit program, if ridership doesn't return to 2019 levels, which I think is unfortunately possible, would you need less, or is this amount determined by some, like, not ridership? It's like,
no, it's definitely determined by ridership.
Okay.
So yeah, I made an estimation of going back not quite to 2019 levels, but almost to 2019 levels.
this is like a ceiling amount, and it's possible to be less.
But the flip side is, the way the costs for the paratransit program work, we are charged per ride. And so if ridership goes, as opposed to how most public transportation generally works, because the overall cost goes down as ridership goes up. Paratransit service is the opposite.
Any other questions or comments?
Can I don't know but I think that this is a fair request, just, and again, it's a very small percentage for such a big department that does so much for so many people that I'd be inclined to give this everything that she's asking for. It's my opinion. So.
I echo what Member Shorzy is saying, and also to Mary's point, she's been asking and talking about this for years. So we really need to address the needs and funding for what she's asking, because this is the heart of what I think service is that we provide as a county board, which is to take care of our residents. So I also stress the importance of this, and we have to sort of vote our values here.
I appreciate that. We need to take care of the staff. We take care of the clients.
That's right.
I was gonna say, I couldn't agree more with both of you. I mean, I think this is really the domino effect. I mean, we've got to take care of our people to make sure those grants get allocated, because in the end, if we don't, our residents are gonna lose, right? I mean, the money's out there. Mary does their best with what she's got, but if we could, support this, I think we've done a great thing, so.
And I do try to, really only charge things to the general fund that can't be charged elsewhere. So the paratransit, there actually is a grant from the RTA that covers a portion of it, but the seniors budget is maxed out, and I have no other room.
And frankly, that ask is very minimal, and I'm surprised you didn't ask for more.
Wait till next year.
Say for all the work they've been doing.
Yeah, really. I'd be happy to build in more.
Yeah.
Go bigger, go
Does
home.
that complete your?
That's it.
Okay, well, thank you so much.
Okay.
And do we have any old business? All right, do we have any new business? All right, I'll request a motion to adjourn.
So moved. Second.
All right, all in favor, say aye.
Aye.
All right, August 17th is our next meeting.